All right. Well, good morning, good afternoon, everyone. Thank you for joining us for today's webinar. We are glad to have you. Today, I am Loretta Maddox. Well, I'm Loretta Maddox every day, but I am joined today by Chad Schiffman, our Director of Compliance, and Nicole Mark, our Marketing Manager. She is going to be handling the questions that you all have on today's webinar. And again, as we talked about last week, for those of you who were not on the webinar last week, we really want this to be as beneficial for you as possible. And in order to do that, we want to hear from you. So if you have questions as we move through today's material, please feel free to send those through chat, and Nicole is going to be getting those ready for us so that we can answer those at the end of today's presentation. So we're going to go ahead and get started. And first of all, I do want to remind everyone that we do have the COVID-19 Toolkit. There are several resources available for you. If you do not know how to access that toolkit, definitely contact your compliance advisor and we will get you set up to have access to those resources. We are keeping these up to date and putting relevant information in there for you to get you through this period. So today, we're going to do our little update on everything that's been going on since the last time that we met. And the first thing that we're going to talk about today, Chad has an interesting fraud case that he's going to share with you all. So Chad, do you want to go ahead and take over?
Yeah, I can go ahead and take over. So basically what we saw is our very first fraud case, or well, the first one that we're actually aware of. And in this case, what had happened is a physician was advertising basically that they had a miracle cure for COVID-19. Basically, long story short, the FBI contacted this provider, asked him a series of questions, and he basically told them, well, yeah, I've got this miracle cure. I've never seen anything like it. You know, it's 100% cure for COVID-19. We're going to make you immune to the virus for 6 weeks. So it was a crazy case to see actually come about. And it's kind of amazing what you see happen in light of, you know, pandemics and such. That's when you get a lot of fraudsters and criminal activity happening. But what was odd in this is that they actually, you know, the FBI did reach out and was disclosed everything he was telling the patients. And this all came about from an anonymous tip. Now, the government's stance on that was basically that we will not tolerate COVID-19 fraudsters who try to profit and take advantage of the pandemic fear to cheat, steal, and harm others. Now, this is according to the U.S. Attorney Brewer, who also said that rest assured, those who engage in this despicable conduct will find themselves in the crosshairs of federal prosecutors. So just know that they are watching closely for any fraudulent activities. I don't expect that anybody on this call would be involved with that, but we just wanted to make you aware that this is the first fraud case that we've seen, and to let you know that there could be those types of things going on out and about.
Great. Thank you, Chad. So now we're going to move into what CMS has issued as far as recommendations to reopen healthcare systems. This is very good news. This is kind of what we've been waiting for, to try to get life back to some kind of normal. And so I wanted to go over this with you to let you know kind of what CMS is recommending, and then how that can be applicable to where you are in your local community or your state. So CMS has issued guidelines for a gradual transition, and they're obviously encouraging all healthcare providers to coordinate locally and with state public health officials to make sure that you're ready to move forward. Now, this is for communities that are in phase 1 with low incidence of COVID-19 cases. And we're going to talk a little bit more about the phases in just a second. But in order to be able to move forward with these recommendations, CMS is recommending that you review the availability of all PPE, make sure you've got enough supplies, that you have an adequate workforce, that the facility is ready to move forward, and then that you do have adequate testing capabilities. And there is more information that can be found at the link at the end of this slide. But again, this is very good news to be moving forward with non-COVID related procedures, elective procedures. And so we feel like this is really good news. Now, in order to kind of understand the process, we wanted to go over basically where we are. And I'm not going to spend a ton of time talking about the phases because I know there's a lot of information out there, but just to make this all make sense. Each state or region has gating criteria, and this criteria has to be met before we can move into the stages. And also keep in mind that even though this is coming from the federal government, it is still going to be based on your local area. So, and we're already seeing how different states are implementing these things. So the gating criteria that has to be met from a symptom standpoint, there has to be downward trajectory of flu illnesses and COVID-like syndromic cases reported within a 14-day period. So that trajectory has to be going down within a 14-day period. The cases also have to be going down within a 14-day period, or a downward trajectory of positive tests as a percent of total tests. And so the key time frame is that 14-day period. And then in addition to that, hospitals have to be treating all patients without crisis care and also have a robust testing program in place for any healthcare workers that are at risk, including emergent antibody testing. So that's the gating criteria that has to be met before you can move into phase one. And remember that, phase one is where CMS is recommending to reopen the healthcare system. So from an employer standpoint, I did want to talk about each of the phases. So I'm not going to get into the individual information, but you guys will have a link to that. But from an employer standpoint, phase one is you continue to encourage telework. So if you've got people that can work remotely, you keep them working remotely. And if you are bringing people back to work, you want to return them back to work in phases if that's possible. They're also recommending that there still be strict social distancing protocols. And if that means we have to close break rooms or common areas where people would congregate, then that is a recommendation as well. Minimize non-essential travel and adhere to CDC guidelines if somebody is traveling. And if they've been traveling and you're bringing them back to work, they have to have that isolation period. So that is still in effect during phase one. And then this is one I found interesting. Strongly consider special accommodations for personnel who are members of a vulnerable population. So this is a situation where you're going to have to look at your employees who might be a part of that vulnerable population and then possibly make some special accommodations. Now, it's not saying it's required, but they want you to strongly consider that. So we're probably going to see a little bit more about that as we move forward.
Yeah,
go ahead, Chad.
I was just going to say, even today, I read a letter from an HCA hospital and got to see that, and this happens to be here in Florida, but basically what they've sent out is that they're planning on getting these procedures, getting patients back on the calendar ASAP, but they're trying to do it in a way that kind of follows this protocol. So basically, they've identified, that maybe we've hit our peak here in Florida. That's what the new data is suggesting. Have we? Well, that remains to be seen, but that's what the data is suggesting. So what they've decided is they're going to go ahead and start scheduling these procedures for, mid-May and onward. So, or actually, I guess it's more like May 11th, and then going forward. So I think that's kind of welcome news. And in their letter, what they're stating is they're going to follow these protocols. So I just wanted to add that.
No, thank you. Thank you for adding that. That's all very positive. So again, in phase one, there are recommendations for specific employers, and I did pull out information that would pertain to healthcare. Visits to senior living facilities and hospitals are still going to be prohibited or should still be prohibited during phase one. But phase one is where we're allowing elective surgeries to resume as clinically appropriate on an outpatient basis. And then again, at facilities that are adhering to the CMS guidelines. So this is very positive news. Now, moving into phase two. So phase 2, the only thing that changes for employers in phase 2 from phase 1 is that non-essential travel, that restriction has been removed. So everything else still staying the same, continuing to telework, return to work in phases, keeping those common areas shut down so we're not congregating, and then again, keeping an eye on any of the personnel that are members of a vulnerable population. Specific employers, still the same. We're still limiting those. Those are exactly the same in phase 2 as they were in phase 1. So phase 3 is basically getting pretty much back to life as kind of normal, maybe, but all employers may resume unrestricted staffing of work sites. So that's huge. And then visits to senior living facilities and hospitals can resume, but they are still recommending diligent hygiene efforts and making sure that we, are continuing on with infection control and good hygiene and things of that nature. So all of this information can be found along with the recommendations for individuals, can be found at the link at the bottom of this slide. So now I'm going to turn it back over to Chad. Oh, wait, I'm not going to turn it back over to Chad. First of all, I'm going to go over the guidelines for all employers in all phases. So this is very important because I think this is an area that we're probably not prepared for at this point. Some practices may be, but the guidelines are that we're developing and implementing appropriate policies regarding social distancing. We probably have never had a policy regarding social distancing before. So this is something that all employers are going to have to look into, especially in healthcare. Temperature checks, sanitation, disinfection of common and high traffic areas, and then also business travel. There are many companies that have issued policy regarding the travel restrictions for the individuals who work in healthcare. So those are new policies that had to be created. So from an administrative standpoint for healthcare, we're going to have to look at developing these policies and procedures going forward. So this is something that does need to be paid attention to. And then also monitoring the workforce for symptoms. This is something, that we're also going to have to do. We're not going to allow people to come back to work that are symptomatic unless they're cleared by a medical provider. And then moving forward, also developing policies and procedures for contact tracing following employee COVID positive tests. So lots of new policies and procedures that are going to have to be created moving forward. Okay, now, Chad, we're ready for you to talk about OSHA.
Okay, great. So also on April 16th, OSHA released some guidance basically talking about discretion and enforcement when considering an employer's good faith efforts during the coronavirus disease 2019 pandemic or COVID-19 pandemic. Basically, the reason why they did this is they recognize that some employers may face difficulties complying with certain OSHA standards during the COVID-19 pandemic. And so basically what they're saying is that they are advising their compliance and safety health officials who may come on site, which, let's be honest, how many of them are actually going to come on site during this? But to consider what an employer has had in place, what are they doing? How are they complying with these standards? What are they doing in terms of audits and reviews and training and assessments? So do you necessarily need to be auditing everything thoroughly right now? No. Do you need to be doing all this formal training on site? No. But what they are saying is, what are some of these options that you have done to apply with these applicable standards? Are your employees doing their best to adhere to infection control procedures? And if not, what are some of the alternative protections that could be in place, whether it's, having different stations set up and those types of things. So all these types of things are what they're looking at. And basically what they're saying is, as long as you've performed or have documentation stating that as part of your risk assessment, that you have which, by the way, we have a OSHA hazard risk assessment that covers your PPE for these types of scenarios, to make sure that you have the relevant PPE for your employees, which has obviously been a big concern. And then you have infection control procedures that they're going to say, okay, you've got some good faith efforts in place. They're not going to necessarily fine you or anything like that, but what they may do is say, hey, let's go ahead and give you a corrective action plan for once once all this pandemic stuff slows down and we can bring you up into full compliance. Now, as part of this, OSHA still recommends that everyone frequently washes their hands for 20 seconds. That's the same that we've heard all along this entire pandemic, avoiding touching the hands and all of that. Respiratory etiquette. Funny story is I kind of felt it this one day. I walked into a grocery store and you know how they're cleaning the carts or whatever, and oh man, I had to sneeze and I couldn't stop it. And so I sneezed and the poor girl looked at me like I had the worst thing ever. Like I just contaminated all the carts. So trying to be more cognizant of that, me and my allergies that I get this time of year. Just happens. Avoiding close contact with people who are sick, that's part of the remote work strategies, staying home, all these things. As you notice, OSHA and CDC kind of work hand in hand on a lot of these types of statements, so you'll see a lot of crossover here. Next slide, please. So under the record keeping requirements, OSHA also issued guidance on this, stating that we need to document if you have employees, who are confirmed with COVID-19. And you want to, the hard part, and OSHA actually does realize this, is determining, was it actually work related where the employee obtained, or had COVID-19 exposure. And then, was treatment beyond first aid or days away from work? So did they have to be hospitalized and those types of things? So all those considerations need to go into place. But know that COVID-19 is recognized as one of those diseases or illnesses that needs to be documented if an employee was actually exposed. Next slide. Now, they won't enforce it if they can determine that it could have been in community transmissions, unless they know beyond a shadow of a doubt that it was work related. So, if the employee, say, had a spouse and they contracted it from that spouse or whatever, and they determined that, and that evidence was reasonably available to you, that beyond a shadow of a doubt that, say, the spouse traveled to a place and came home and infected the employee, for example, then you wouldn't need to document it under those circumstances. And then they also wanted to remind us that employers of workers in healthcare industry, emergency response organizations, and correction institutions must continue work-related determinations. That's still the same. That's nothing that's changed. That's still an OSHA requirement. Next slide.
All right. Well, thank you, Chad, for going over that information. And I think now we are at we wanted to revisit the question that we had at the end of the webinar last week on the Provider Relief Fund. Some new information that has come out since our last webinar is the attestation portal is now open, and you do have this link here. Some of you may have already been on this link and have completed your attestation. But just as we didn't go over it in detail last time, so I'm just going to give a little overview of the funding. Any providers who have been allocated a payment from this initial $30 billion must sign that attestation confirming receipt of the funds and agree to the terms and conditions. And you have to do this within 30 days of payment. You also must use the portal if you choose to reject the funds. You have to go onto the portal as well, and you also have to do that within 30 days of receipt of the funds. And so I want to talk just a little bit about one of the biggest questions around the terms and conditions is whether or not care must be provided to patients specifically for a COVID-19 diagnosis in order to keep these funds without repayment. HHS is saying that these are payments, not loans, to healthcare providers and will not need to be repaid. There is a little bit of confusion in the information that's out there, but I do want to go over, this is information directly from HHS. All facilities and providers that received Medicare reimbursements in 2019 are eligible for this distribution. In order to be able to attest to the terms and conditions, you have to agree not to seek any collection of out-of-pocket payments for a COVID-19 patient that are greater than what the patient would have paid if it was at an in-network provider. So if you're an out-of-network provider, but you see a COVID-19 patient, in order to keep these funds, you can't charge them the out-of-pocket payment as you would normally for an out-of-network provider. The other bullet that was on the HHS website is if you ceased operation as a result of the pandemic, you're still eligible to receive funds as long as you provided diagnosis, testing, or care for individuals with possible or actual cases of COVID-19. And then this is where HHS goes on to say that the care does not have to be specific to treating COVID-19, and that they broadly view every patient as a possible case. So we do have that information. It's just the placement of that information that's a little confusing because it's underneath the whole if you cease to operate as a result of the pandemic. So that has put this into question. On last week's call, we did have an attendee that provided information that they had received from the AAOE that stated they had had a call with HHS, and that HHS has stated that specialists like orthopedics are eligible for receipt and use of these funds, and that the primary reason that they would require repayment would be from grave misuse or illegal use or surprise billing. So we do have that information, but I think we're going to get more guidance as we move forward because this has been a little bit confusing, and because the money was just given to you. There was no application process. It was just distributed based on your fee-for-service reimbursements in 2019. So from the standpoint now of what do you do? Do you keep it? Do you reject it? That is a decision that's going to be based on you're going to have to make that decision. But some recommendations that we have is do read the terms and conditions, and there is a link from this slide, and determine if your practice meets those terms as they're currently written. Keep detailed records of expenses and revenue losses attributable to this particular public health emergency. I think documentation of how this has impacted your practice is very important because there has been so many funds issued as a result of this. At some point down the road, there may be a request for information to back up those expenses and the losses of revenues. So you definitely want to keep good and accurate records of that. And then if you're unclear if you meet the terms and conditions, you might consider holding your payments and received until further guidance has been issued. But if you do that, you want to make sure that you will need to attest to the terms and conditions within 30 days of receipt if you intend to keep it. And then if you decide, okay, our practice doesn't meet the terms and conditions, then you still have to go through that attestation portal and notify HHS that you're not going to keep the funds. So I know this is quite confusing. We're hoping to see more guidance as we move forward. And of course, we are going to be keeping you guys updated on anything that we see as far as from a guidance standpoint. Chad, did you have anything you wanted to add to that?
I apologize, I was on mute. No, not actually.
That's okay.
No, I think you covered that well. Actually, I don't think we need to add anything there. Unless anybody has any questions that they want to ask, of us, I think we covered everything.
Absolutely. And just as a reminder, if you do have any questions, and I know we've given you quite a bit of information, but if you do have questions, go ahead and send those in. Nicole is going to be getting those out to us, and we'll do our best to answer those in today's webinar. And if not, we will follow up. Sometimes because these are things that are so new and different, and there's so many things that are coming out from the government that it sometimes does take a little bit for us to dig in. And so if we can't answer your question on today's webinar, just know that we will follow up and we will get you an answer in writing. So the last thing that we wanted to talk about today is just compliance in general now, and then as we move forward beyond COVID-19. Some of you may have some downtime right now, just because of the way things are going in your practice. Some of you may not, some of you may have less time. But for those of you who have had compliance tasks that have been sitting on a shelf somewhere because you have not had time, now is a great time to utilize some of that downtime and get your ducks in a row. Address any new procedures that you've implemented. We have a lot that you're probably doing differently now than you were, a couple of months ago. There may be many of you who are doing telehealth that you haven't been doing before. You have workers working remotely. You need to address those new procedures, and you need to figure out, am I currently in compliance? Do we need to do things to get in compliance? And start thinking about those things now, because if you start developing habits in doing things in a certain way, especially with some of the enforcement discretion, but once this public health emergency is over, that enforcement discretion is going to go away. And at some point, the government's going to get active again in making sure that everybody is compliant. So use this opportunity that we have now to really look at what you need to do to be in compliance, and don't do it alone. You have resources available here from us. We want to help you through this process. We are developing things as well because, like I said, there's so much that's new. So just some tips to think about. And then as we move forward with next week's webinar, we do want to talk a little bit more about the future and things that you're going to need to put in place that isn't currently in place. So be thinking about those things as well. If you have questions that you'd like for us to address, you can send those in, and we will look at that as well. So Chad, did you want to speak to any of this before I move on?
I would just add, along those tasks, I think this is a great opportunity to knock out the SRA. If you haven't done your security risk analysis yet this year, it's a perfect opportunity. Because quite often one of the things that we hear when we're doing these reviews is, I just didn't have time to do it. And maybe this is a good time. I'm not saying, maybe it isn't for all organizations, because some organizations may, depending on your staffing needs, but if you have the availability, now's a great time. You don't have to do it. Remember, risk analysis is an ongoing process. So if you have the opportunity, it's a great time. And those types of things. And then just making sure you have the policies you need, those types of things. And once again, if you ever have questions, please do reach out to us. We want to help you to the best we can.
And that's a great point for the SRA, because we've got key things that are happening that have just started happening for some of you with telehealth and remote access that you may not have been doing before. And those are absolutely things that need to be included in that SRA. So Chad's right. This is a great time to do that. Okay. Well, just as another reminder, we do have the toolkit available, and we are continuing to add information to that. So definitely utilize those resources. And if you have trouble getting to it, definitely let your compliance advisor know. And at this point, Nicole, do we have any questions?
Currently, no. Just the reminder to go to our website, healthcarecompliancepros.com COVID-19-toolkit. And this afternoon, we will make sure to get this slide deck uploaded for you along with the recording.
Yeah, I think that was our one lonely question was, will the slide deck be uploaded? And I think that just answered it.
Okay, wonderful. Well, thank you again, everyone, for joining us, and we hope you have a great rest of your week. Take care.